Good morning to all of you. Some of you are wondering what is the difference in the country over 30 years and what is the difference in our own trying to be of service in the country of Haiti after all these years. And you put forth 4 questions, one of which is, are the problems still the same as 30 years ago? The fair answer is the problems are returning to be the same as 30 years ago, because amazingly, and even in spite of tremendous difficulties, the first being a totally unfair access to resources which would help a country that's still developing. What's totally amazing is there have been improvements in Haiti over these years, and when there are political and economic disruptions, and I say that with capital D, when there are political and economic upheavals, then we start going back again very fast to where we once were. It takes a long time to gain ground, and it takes a very short time to lose it. The life indicators, how old somebody lives to be before they die, children mortality, the rate of malnutrition, the rate of illiteracy, all of these are scored by nations on a scale of life indicators. I believe the life indicators in Haiti are better than they were 30 years ago. I believe that. And I just emphasize again how fast everything can go backwards. So the second question is, do children still have access? For sure, there are more medical centers than years ago. For sure, there are more medical staff than years ago. By the same token, we have the brain drain, which is being reinitiated again, where capable people who have other options in other places, it's very hard to convince themselves to stay in a country like this for the sake of their families. So in spite of having more, there are also losses. But the other big thing is, when I came to Haiti 30 years ago, the population was 6 million. Now it's, I think, 11 million. So even with more physicians and medical staff, access is still challenging because the ratio of medical personnel to the population is really skewed now with such a massive population. A question is asked of whether we get the medicines that we need. A very big problem in unregulated and underregulated countries are false medicines, businesses that exist to capitalize on somebody's ill health in order to make a fast buck by making a tablet out of something that won't harm you and calling it something that you think is going to save you. So it's challenging here, as in many places. We have to be really careful where we buy the medicines. Access to medicines, we have to face it. We can stock our pantries totally and our pharmacy totally, and if there are tires burning on the road and shootouts at every street crossing every day, nobody can get to the hospital to get the medicine. So access is also limited by the very unfortunate political and social violence in the country. But for sure, for us to get real medicines, the ability has improved a lot, quality control. For us to have a lot on stock has totally diminished since the gourd dollar value has fallen to about 75 gourds to the dollar when we were at up to 120 gourds per the dollar. So my answers are all, as you can see, yes, but the buts are really important. Are we willing to keep fighting and not lose ground? Yes, totally. We're willing to keep at it, and preserve the ground that we have and still keep trying to improve totally. Why? Because of the touching part of the work. Obviously, the touching part of the work is not statistics about children, and it's not ratios of cost of medicines. The touching part of the work are the children who are in front of you every day. So last night, for example, right here, I delivered a baby right in front of that staircase of a woman who just came too late and couldn't even make it upstairs to maternity. And in the middle of all these problems, and this poor woman to have to give birth in such a public way, but it was a baby, and the baby came out roaring to go. And it's thank God we were here for her, and thank God she wasn't on the street between here and there. But it's very motivating. Some situations, for example, there was a 3-year-old female little girl who was brought here for serious burns from one of the road blockades of last week. We don't have a burn center. Doctors Without Borders, their centers were full. Burns are long hospital stays. You're a long time in the hospital with burns. And so it was distressing. By the same token, it engages you more in wanting to do more and to solve problems. And in her case, I was able to put her in a private hospital at my own expense. But I could do something. Not everybody is so lucky to be able to have resources to do it, but I was able to do it. So these are two personal cases just of these days that increase the resolve of those of us who are on the front line. Beautiful and tragic, and yet they both increase our resolve. So thank you very much for your support over the years. We need it, we count on it, and we put it to good use for the children.